Hi, my name's Mary Copeland, and I am the owner and founder of Compass and Clock, this wonderful publication. I'm terrible at that. This is the spring issue. The fall issue is being uploaded to the printers this week. So very excited to get that out in your hands. As always, it'll be a free publication. 80 pages chock full of invaluable info. And in this upcoming fall issue, Dr. Garrett Soames, who is the owner and founder of HouseCallMD, and he is our speaker today. He has an article in the issue for me. I thought it was very important that he tell everybody about house calls, telemedicine, and a COVID update. So in addition to the seminar that you're in today, and some of you were in the one at 11:30, there are 4 more seminars this week, Wednesday and Thursday at 11:30 and 2:30. So I encourage you to go to the compassandclock.com website and register for some other ones. And if you were already registered for this one, you actually got an email that had a link and the days and times for all the other seminars. So you can actually just click on those too and join us. Garrett, do you have a PowerPoint that you want to use?
Sure. Yeah, I can pull up a PowerPoint that I have. Let's see.
Only if you want to. It's totally up to you, but I set up the screen share so that you can do that if you want it.
Yeah, let me pull up a PowerPoint then, and I'll share the screen here in just a second.
Yeah. Hi, Heidi. Welcome back. Glad you could join us for this one too. Hi, Heidi.
Hey.
Nice to have you with us.
Thank you. Nice to be here.
All right, so I'm sharing my screen for everybody now.
So Garrett, I had sent out to everybody, but there are some people that are on the call with us now that, no, they would have all gotten this. You all have a flyer that I sent with the email that had a little bio and write-up of the presenters. But Garrett, why don't you tell the folks a little bit about yourself? And this is being recorded. So for folks that were unable to attend today, to be able to do this live with us and ask questions, I am recording and it will be posted on the Compass and Clock website. So people can watch it at any time. It'll be archived there. So the floor is yours, Garrett. And if anybody has questions, right now I ask that everybody put themselves on mute. And if you have questions, just use the chat bar and I will interrupt Garrett and ask the questions for you.
All right, great. Well, I'll just go ahead and get started. My name is Garrett Soames. I am the founder of HouseCallMD. We are essentially a telemedicine company that also does the traditional house calls at patients' homes. And again, I am doing a brief presentation on basically the upcoming changes with healthcare here in the United States and how telemedicine and house calls are anticipated to play into all that. So we'll go ahead and get started. What is telemedicine? Telemedicine is essentially the use of new technology, video conferencing technology in particular, that allows you to both speak and see someone across your computer screen or smartphone screen. This is actually was originally designed for use of specialists like cardiologists and urologists and whatnot, to allow them to work in more rural areas, or at least consult with physicians like primary care physicians. So it actually was originally a doctor-to-doctor call that then started being reimbursed. And then it was then added to the use of specialists in ERs, like teleneurology, where a stroke neurologist would then be in like an ER and determining if a patient needed like the clotbuster medicine to help facilitate advanced care. And now it's pretty widely adopted across the United States, but again, only recently with the changes in coronavirus, has it actually been approved for more widespread use for payment by Medicare and Medicaid and such. The benefit of telemedicine is if it's widely adopted, it could save billions of dollars in healthcare per year, because again, a lot of the expensive care in the United States is related to more of the acute care or decompensation of a chronic condition like congestive heart failure, a renal failure and such, that ends up in the ER, where again, the costs are literally 8 times as much as it would be in an outpatient setting. So it keeps people out of the ERs in that regard, in that they can get more regular care and follow-up. Telemedicine is very convenient, and so again, that hopefully will allow people to see their doctors more regularly, though a lot of people do struggle with using the technology, in particular the geriatric population. Quickest method to be provided by a medical provider can be seen same day in a lot of cases, although a lot of primary care offices that started using it during COVID, you're still having to wait, several weeks to see them. It's often fee for service. So if you use one of the larger companies like Amwell or whatever, they don't take your insurance. You can try to get reimbursed by your primary or by your insurance provider after the fact with the receipt, but they do not bill insurance at all. You just pay out of pocket. Again, the benefit is that you can reach anyone really with a smartphone, and you can talk with a doctor or consult with a doctor. And one of the more recent benefits, or at least the more poignant benefits, as now that we're in a pandemic, is that you're not exposed to others in like a waiting room. There are plenty of downsides to telemedicine. It is great for chronic issues like managing your blood pressure or diabetes, those types of things, because you're already on your medications, and it really just takes some adjustment sometimes. So chronic issues actually work really well for telemedicine. However, the diagnostic accuracy is fairly low for acute conditions. The reason for that is, again, in the absence of any good physical exam or vital signs, things like that, it's harder for those of us who wear white coats to determine exactly what's going on. If you have ear pain and I don't look in your ear, I can't say with any certainty that it's an ear infection versus a cerumen plug versus tympanic membrane. TMJ, like temporomandibular joint disorder. It's hard to determine without a good physical exam, and so that is one of the downsides of telemedicine. You can't administer medicines on site. So if someone is feeling bad and you need a shot of medicine, antibiotics and such, there's no ability to do that via telemedicine. No testing is available either. So if you needed to do a flu test or a strep swab or blood test, can't do that via telemedicine at all. So there is a big downside there. If prescriptions are needed, you still end up having to leave your home to go to the pharmacy anyways and sit next to people who are coughing and sneezing and such. So it sort of does take away the exposure thing if you have to get a prescription medication. Again, it lacks that personal touch, which is kind of one of the kind of cornerstones of medicine. There is a higher incidence of antibiotic use, considering, again, if I'm not entirely sure as a medical provider what's going on with your ear pain, I may end up calling an antibiotic, which might not have been necessary had I been able to do a physical exam and determine it's from another cause. Same is true for like a urinary tract infection, or at least a suspected one. If your urinalysis is normal, it may be something else triggering the discomfort, and you may get an unnecessary prescription. And then, like I mentioned before, a lot of the geriatric population struggles with the newer technology and smartphones, and so they can't do it anyways. And that's actually been recently proven with a study that 80% of people over age 65 really struggle with use of this technology. And so it's not reaching the people who need it the most. And like I mentioned before, payment, at least before COVID, was very limited. It is still variable, though with the CARES Act, which was passed by Congress, it is now required by all payers to pay for telemedicine. So house calls, what are house calls? They used to be very, very common. In fact, up to 40% of all healthcare visits were house calls. However, by 1972, due to changes in payment with the institution of health insurers, they just decided not to pay for them. And so only 5% of all healthcare visits were house calls by 1972. And ultimately, that continued to drop, and where they're almost non-existent now. Again, it was mainly due to lack of private insurers paying for this service. And again, in an office, you can see a lot of people in a short amount of time. They come to you, you can put them in several rooms and move kind of like a conveyor belt as a medical provider. And so, whereas with a house call, now the doctor has to travel to you, and with traffic and all that, they now take on that additional difficulty of your medical care. And so a doctor can only really see a certain number of patients in that amount of time, limiting the amount of reimbursement. And as such, it has actually, house calls actually became a non-feasible model for in regards to reimbursement. Basically, it costs more to see patients in their home than it does to actually pay for the doctor's salary and pay for gas and all that. House calls are by and large the most convenient method for any patient, because then they get to see their doctor, they get to see him at home, they don't have to leave. You can have labs done at home. Again, with the advent of new technology, you can even do bedside ultrasounds and stuff in-house. The benefit, is that you can develop a rapport with your patients, and again, the doctor that you prefer can come to your home. And a lot of homebound patients, the only option they have to be seen by a doctor at all is either a house call or a 911 call, because they're homebound. They can't move, they can't maneuver in their own homes. There are downsides to house calls. Again, not cost effective, like I mentioned, not covered by insurance 100%. Again, even though technology has allowed for a lot of mobility in regards to diagnostics and such, there are still limitations. You can only, although there are mobile x-rays, the permits and such to carry around plutonium in the back of your car makes it very limited. So you can't always have all the diagnostics available as you would in a traditional urgent care or such. And then again, there is that risk of infectious exposure. So what is HouseCallMD? That's again the company I created. It's like I mentioned, with insurers not really paying for house calls anymore, we've developed kind of a tier-based system in regards to seeing a patient and based on their complaint. So if you don't always have a doctor go to a home, who again, you have to pay more for a doctor than you would for a nurse or an LPN or a medical assistant and such. We now have the additional staff members traditionally going to these patients' homes and augmenting the telemedicine visits. You always get a telemedicine visit. You always talk with the doctor, but there will be an additional staff member on site who will then facilitate medication administration, testing, strep, flu swabs, and such, and collect data like vital signs and whatnot. So we are the only company that has actually implemented this type of healthcare. We're calling it augmented telemedicine. Again, we're the only company that does telemedicine, but also sends someone to the patient's home to collect vital signs and again, administer medications. We give a direction to that healthcare technician, and they use, again, technology to help facilitate the diagnosis and treatment. So we use digital otoscopes to get pictures of patients' ears. We use those same digital otoscopes to get a picture of patient's throat if they have a sore throat. We do digital stethoscopes, which record the heart and lung sounds of the patient, and then that's digitally sent to the medical provider, who can use all this data to help determine the appropriate diagnosis and hopefully avoid unnecessary prescriptions and treat the patient with a more accurate diagnosis. Again, the medical technicians with HouseCallMD, they can, again, use digital photos. They can record the heart and lung sounds. They can help with the actual technologic aspect of a telemedicine visit by facilitating that visit via Zoom calls like we're on now, or another telemedicine service. They can draw blood while there. They can administer medications and provide injections. They can do EKGs. And then they can also dispense the prescriptions. We have a lockbox full of the most commonly prescribed medications. And so the patient never has to leave their home and go to the pharmacy. Again, the most important thing is it adds back that person-to-person interaction that is lost with traditional telemedicine. With COVID being as scary as it is and widespread as it is, what we've started to do is partner with a lot of these long-term care facilities who, again, have the patients with the greatest risk for poor outcomes. And so we facilitate these visits usually with the staff that are already there, the LPNs and whatnot that are already on site. So we do training of them and help them provide the additional care with the augmented telemedicine. And what it does is it keeps these, traditionally, for example, in an assisted living facility, if a patient gets symptoms of, say, a UTI, they then have to be sent to an urgent care or the primary care doctor's office to get testing and diagnosis and treatment. And so unless you're in an actual nursing home where they have maybe a doctor on site, assisted living facilities, memory care facilities, adult family homes and such, all of these high-risk people are then sent to either an ER or an urgent care to be seen and treated. So we basically go into these facilities and partner with them to hopefully keep down the risk of exposure to things like the flu or COVID in the waiting rooms. Again, we help these facilities and we reduce the risk of COVID in the facilities themselves. Currently, every facility that HouseCallMD is partnered with has had 0 cases of COVID. We're pretty proud of that fact, especially since some of the facilities we work in are directly next to or less than 500 feet from another assisted living or nursing home facility that have had outbreaks to the point that they've had to close down completely. So we're pretty proud of our algorithm and our treatment options for these facilities. But again, we treat everyone in the community as well and can go to people's homes for testing and treatment. And again, the idea is we don't just do COVID testing, although we are the only company in Washington State that does at-home COVID testing. We pride ourselves on, again, basically treating anything and everything we can to save healthcare dollars by keeping patients out of the ER and providing convenience and appropriate care. And so ultimately, with changes with COVID, what's going on is that it's very likely that telemedicine will now be covered at 100% in all states. And ultimately, we hope that as things progress, this house call model / telemedicine model will increase access to care and improve the outcomes of our patients.
Everyone, why don't you unmute? Oh, I should take my pen. Why don't you unmute and let's ask Garrett some questions. Looks like John just had to take a phone call. Carol, Tim, you have any questions for Garrett about telemedicine, house calls, how insurance works, COVID-19 update, flu shots, anything? You all need to unmute yourselves.
Well, I will ask
Okay.
a very basic question. You asked us to unmute ourselves, and I had no idea how to do that.
Well, you're unmuted now, and we can hear you. So go ask Garrett. Ask away.
So I just got an option that said, do you want to unmute? But initially, I didn't know where to go when you asked us to unmute.
Oh, in the bottom of your picture screen, it'll show when you're muted, there's a microphone that's red with a line through it. And in the top right, it says mute or unmute.
I see it.
Do you have questions for Garrett about telemedicine or house calls? He is in your area. He does cover Port Angeles and Clallam County.
Well, this points out the fact how difficult it can be to manage some of the software that is necessary for telemedicine, which again, it's very limiting for a good portion of the population. So, you know, having the technician actually come out now allows telemedicine to be available to people who struggle with you know, any issues with any of the software that comes along with telemedicine.
Well, there's also computers that they don't all have cameras. So
Correct.
people want to Zoom, but there's no camera for them. And someone today on an earlier Zoom, their audio wasn't working. So they were at least able to use the chat bar to ask questions. John, do you have any questions of Dr. Soames regarding telemedicine, insurance, house calls, COVID, anything?
I'm a retired architect, and my specialty was health facilities, and my father was a doctor who made those house calls throughout his whole life. And I think that's a really creative approach to sending people who are techs out to do tech work and then consulting with a physician. I think it's really something that should work. So I'm happy to see it. I don't have a question.
Well, as Garrett had explained to me once, you know, folks that are housebound and they don't drive themselves, they don't have a friend or a neighbor that could possibly take them to a doctor's appointment, then they have to call for transportation. And the Medicare dollars that are tied up in that are huge. And then the whole scenario with time, you know, whether they're using public transportation or a friend's taking them or a loved one, between the transportation to get there, the time in the waiting room, the time with the doctor, then the time going to get your prescription, etc. You're talking many, many hours.
Yeah, I had to leave for just a few moments, but is this service available on Bainbridge and in Olympia?
Yes, to Bainbridge, and currently part-time in Olympia. We have one staff member down there who is currently kind of through Olympia and up to Allen, kind of through Shelton and all that. So yes, we do have this service part-time in Olympia.
And is it pretty flexible? Like if I pick up the phone, will I have somebody that afternoon, or will it be a day or two?
It depends really on the staff available and also on your complaint. So again, if it's something that does require a physician on site, something more complex, it's obviously there tends to be a little bit more of a wait. If it's something as simple as, you know, a COVID test or, you know, blood draw or something, then we often can get people same or next day. So it really just currently we're in a growing and expanding company, but we are ideally going to continue to expand. We have an app that's going to be released this week, which will make it easier for patients to register. But yeah, if you want to just call, we can get you scheduled. But yes, we usually see 1 to 2 patients a day on Bainbridge Island.
Great.
I will put the information for the website and the phone number in the chat bar, and it was in the email that had all the information for your Zoom calls. But I called Garrett at the end of last week and called the toll-free number and said I need to make an appointment, and he was out to see me yesterday.
Oh,
came out to
great.
Bainbridge Island.
Great.
And And we even did it outside. I said, let's go in the backyard. We both had our masks on. He had on his gloves, all his protective gear. And what were you here, maybe 5 minutes for what I needed?
Yeah.
In
Most
and out.
visits are pretty simple and quick. We're often, in and out in 10 minutes or so, unless, again, blood work or more thorough evaluations needed.
And did the insurance pay for that?
Well, yeah, so we take most major insurances, Medicare, Medicaid, Premera, Regents, Aetna, TRICARE, all that. So we do accept most major insurances. We try not to balance bill our patients, meaning if there's a difference in what insurance pays and what they don't, we usually don't try to send out for the remainder. But we do work with a billing company that helps us with that. So.
And then he'll even HouseCallMD, if I understood correctly, will work with people that don't have insurance with a flat fee payment plan, depending on what it is that they're being seen for, correct?
Correct. Yeah, we do have just a flat payment. So if a patient is needing an actual medical provider on site, like a doctor, that we just flat bill them at $200, which means that covers everything included, even if you need blood work or whatever. And then we, if it's just telemedicine, like you just want to talk to somebody over telemedicine, it's $40 flat rate.
And they work with everybody where they live. So whether you're in your own brick and mortar house or you're living in an assisted living community or independent or adult family home, they come to you where your home is.
Hmm.
Yep. So Garrett, there were supposed to be 1, 2, 3, 4, 5, 6, 10 people on the call today. So I'm sorry, I think this beautiful weather is getting some of our listeners today.
And I don't blame them. It's a beautiful day today for sure.
Oh, we have somebody coming on now. L, who's behind L, E-L? Hello? Somebody just joined us for the telemedicine and house call and COVID update.
Hello.
Yes, what's your first name?
It says my connection is unstable.
What is your first name?
I've got to turn things down. What did you say?
What is your name?
Elaine.
Elaine?
Yes.
Hi, Elaine. Nice to meet you.
Hi.
We were just wrapping up the call, and I have recorded it. So you will be able to view it on the Compass and Clock website. But do you have any specific questions for Dr. Garrett Soames pertaining to telemedicine, house calls, and COVID-19 updates?
No, I was just going to listen in.